my name is Chloe Richmond and I will be your nurse for today. I understand you're here to undergo Mohs surgery for basal cell carcinoma removal. Basal cell carcinoma is an overgrowth of the skin's basal cells which line the deepest layer of the epidermis or outer layer of the skin. It is usually caused by overexposure to the sun, which makes sense for you since you were raised near the beach and have very fair skin. Basal cell carcinoma almost never metastasizes, but it can be disfiguring if not treated early, so I'm really glad you're getting this taken care of now. I would like to speak to you briefly about the process and the procedure and answer any questions you may have. The Mohs surgery is a procedure where a specifically trained dermatologist will numb the site of the cancer with a local anesthetic using a scalpel. The surgeon removes a thin layer of visible cancerous tissue, and then the surgeon will bandage the wound temporarily while they take the specimen to the lab. They will then look closely at the specimen under a microscope to determine if the cancer cells are still present. The surgeon will repeat this process until the site's clear of all cancer cells. Then they will close the wound, and then depending on the size and location, you may need reconstructive plastic surgery, but they will work very hard to minimize any scarring there may be. The entire process can take up to several hours depending on the size and location of the cancerous cells. The good news is Mohs has a very high cure rate of about 98% and is considered the gold standard of treatment for basal cell carcinoma because it conserves the greatest amount of healthy tissue and has less potential for scarring. At the end of the procedure, your wound will be bandaged and you will be given specific instructions on how to care for your incision. The wound care is very important. You want to keep the area very clean and dry and avoid any potential infections or scarring. You may receive a prescription for antibiotics as well. Do you have any questions regarding the treatment? No? Great. When would be the best day to return for a follow-up appointment to have your stitches removed?